Thank you for taking the time to watch this video. This is going to be dedicated to the discussion of drain management. Okay, so we're going to be talking about the use of the Jackson-Pratt drain, also known as the JP drain. This is a type of closed suction drain that we use very frequently in plastic surgery. It could have been used in your particular surgery for a tummy tuck or abdominoplasty. Also would be used for liposuction procedures and the like. So we felt it was very important to help our patients understand a little bit more about how these drains work and what they look like. So first of all, we just want to show basically an idea of what the drain looks like. It is basically a perforated flat drain, and this can be cut to size during your surgery. It doesn't have to be this entire length, but many times we use the whole drain. So we just wanted to give you an idea of what this looks like. This drain is basically connected to a bulb. Okay, so this is the bulb, and this bulb, you can squeeze it closed and then you can cap it. Okay, so once you cap the drain, it will create a negative pressure system or a suction system through these little perforations here. Only thing you need to worry about is making sure that you empty the drain, which means you take off the cap, you let it open, and then you empty the drain, okay? This can be emptied in the toilet, for example, in a measuring cup, and then in the sink or the toilet. Either one is perfectly fine. Basically, what you wanna do after you've emptied it is you wanna squeeze all the air out of the drain, okay? Very important, squeeze the air out, and then you're going to place the cap back onto the drain, okay? This is going to then initiate the negative pressure or the suction on the drain. Another topic that we discuss with our patients when you're in the office, either with our recovery nurse right before you go home or with our registered nursing staff in your post-op visits, is what's called stripping the drain. Okay, so stripping the drain essentially involves squeezing the drain, okay, and pulling the fluid out of the drain. So it's basically a pinch and squeeze maneuver. Please remember that when you're doing that, you want to pinch and squeeze towards the bulb, okay? So pinch and squeeze towards the bulb so you can get all of the liquid out of the drain and into this container or reservoir, okay? You want to try to do that every 4 hours when you're working with the drain. That's going to help unclog it. It's going to help to essentially keep the fluid flowing into the bulb. This can be a little bit confusing for some patients. Please do not hesitate to let us know if you have further questions. We will be demonstrating how to manipulate the drain during your recovery visits and right before you go home. And ideally, you bring a family member with you or your caregiver that we can also explain how to use the drain. The drains can last, depending on the surgery, for up to 5 days, 10 days, 21 days, okay? And this all depends on the type of surgery that you had. For abdominoplasty or tummy tucks, some drains are in for almost up to 21 days, but by that point, we have removed them to avoid any further issues with them. Also for liposuction surgery, the drains are kept much shorter time frames of typically 5 to 7 days. And this all depends on the output of the drain from each particular patient. Everybody is very unique, everybody is individualized, and you don't want to remove any drain unless you have 25 milliliters or less in 24 hours. So I'm just gonna repeat that so everybody can catch that. You do not want to remove the drain unless it has 25 milliliters or less in 24 hours. That is how we can ensure that your body is going to be able to absorb any remaining fluid once the drain has been removed. Now, drain removal is very easy, okay? You do not have to have a physician remove your drain. We are gladly able to teach you how to remove the drain in our office. It simply involves cutting the stitch that is securing the drain to your skin. Once you cut that stitch, it basically frees the drain completely and you're able to remove it very easily. So please don't have any excess anxiety or hesitation or worry about the drain. It does not hurt when it is coming out. It slides out very easily, very softly, and it will not cause you any significant pain, just a slight discomfort. Once you have the drain removed, please apply a little bit of bacitracin or triple antibiotic ointment to the drain site. You can cover the drain site with a gauze, as it will probably leak for the first few days. Typical drain sites close, those little wounds close, in about 72 hours. So it's a great idea to massage any liquid that remains behind out of that little drain hole while it is closing. But again, do not apply bacitracin for more than 3 days, as it can cause damage to the skin. If you have any other questions or concerns, remember, we have a 24-hour nurse on-call service that you can call at your convenience, and we will help you to answer any further questions. Thank you for watching this video, and we hope to see you soon.